Hello. Actually, today I had a patient, a pregnant patient. She asked me about the immunity, and the reason was we discussed about this issue because she's a hypothyroidism. That means the low function of the thyroid glands. She's on the therapy, and just we had a couple of minutes, like explanation, and it made me now to a little bit explain about the immunity, how the immune system in the body functioning, how the cells functioning. As you know, when everybody was born, the system of the body is built on defense to many micropathology and microorganism. Two category of the cells are very important. One is the lymphocyte, and the second is macrophage. There are many other also cells like a chain of the immunity, like a complement and other thing. The macrophage is a macromolecule which swallow the microorganism, killing, destroying, and the other category which is like more practically in sense of the clinical evaluation are lymphocyte. Lymphocyte is so significant, and our body producing like automatically. I don't want to go more to like a embryology point of view to explain, but just briefly, the main source of the lymphocyte is a T lymphocyte, which is from the gland thymus retroesternal location, and the B lymphocyte, which is from the bone marrow and is producing. So this two structure, that means the bone marrow and thymus producing T lymphocyte and B lymphocyte. They circulate in the blood and the whole body and going to the target tissue, target organs, and fighting back the microorganism. For us, it's very, very important. I'm not an immunologist, I'm an OBGYN. As a gynecologist, it's important the antibody. When we talk about the antibody, theoretically, we can know more about the immunoglobulin. Many of you heard about that one, especially pregnant ladies or ladies who are a little bit, they have the age and getting older, so they know it. Of course, the youngers, they don't have more information, but the immunoglobulin is a biochemical structure with four chains, two chains of the light chains and two heavy chains, making like a epsilon or Y forms. This chemical structure. I'm sure every of you know the basic information. However, when they produce it, especially the immunoglobulin coming to the plasma cells, and plasma cells, in fact, activated and producing the sense of antibody. There is no huge difference in practical point of view. The discrepancy is really almost very narrow. The antibody actually is the immunoglobulin. The antibody is a more practice. When we talk with the patient, we say the antibody exists in your body, or you don't have, or is high or low quantity you have. So the immunoglobulin is a glycoprotein. That means it's a macromolecule built by protein and especially glucose structure. Usually we have the derivative of the immunoglobulin is 5. It is so important to know about that basic information, because I'm saying it's almost every branch of the medicine, the doctors and even the patient who suffering the diseases or who getting better know about the immunoglobulin. somehow immunoglobulin reaction to the virus, bacteria, cancer, and many immunity disorder in the body. Then we have the immunoglobulin G, A, M, D, E, all of these. G is very the most common one, and the majority of the antibody which circulate in the body is the IgG. IgG is showing or indicated the chronic disorder or disease or infections or virus in the body. So that means it's a sign of the infection happened many months back, many weeks back. So it's not really new one. Then we have of course, the IgG. It has the ability to pass the placenta. This is very important for us as a OBGYN. Pass the placenta, somehow protecting the baby to some diseases, and sometimes could hurt the baby if is abnormal IgG due to micropathogen. Then we have the IgA. IgA also is important, which is somehow secretory immunoglobulin, is actually present in saliva, in lung surface, in mucus of the esophagus, in the mucus of the intestine, and even in the all part of the GI tract. And there's this IgA very important because when there's some pathogen inhaled or ingested by the foods or by the air, so the IgA is ready to fight back. And we have the IgM. IgM is parallel to IgG. IgM and IgG, they are really, when we do the laboratory examination, the analysis, these two is important because the IgG is showing the chronic disease, and IgM is a very quick and rapid reaction to the disease or virus, micropathogen. We can follow the IgM and IgG, and somehow we can say the patient have the disease, the infection recently or long time, and is protected. And then we have the IgE. IgE is so famous, it's very clear for most of you, and it is actually the immunoglobulin for the allergy. So you know that one. IgE is for the allergy, for the venom, for the biting, for the parasite, and many reactions. It's causing the histamine cells to release the mast cells to release the histamine. So this is the IgE. We talk about that one. IgD is not really very significant regarding the clinical point of view, and research is going on this immunoglobulin or antibody, and from my point, we don't have really most like a practical deal with the immunoglobulin D. So that was the brief explanation, and finally, we know sometimes the autoantibody in the body can destroy the tissue. Perhaps you heard about the Hashimoto's disease, you heard about the celiac disease, you heard about the rheumatoid arthritis. So this is the autoantibody producing in the body, and sometimes we cannot find the etiology, just is discovering. The reason I'm saying about that one, because our body, inside our body, or body producing millions antibody, and some of them is like an autoantibody which can destroy the organ. For example, rheumatoid arthritis, hurting, damaging the joint and damaging the cartilage. That's the one. And at the end of the day, I would like to talk, just say, immunosuppressive and immunostimulating antibody, which can help the patient regarding cancer, regarding some immunodeficiency, and this antibody treating the patient or stimulating, or they have the ability to suppress the bad antibody which is produced like as an exogenous antibody, not as an endogenous. Endogenous, that means is producing inside the body, and exogenous is by the prescription medication like pills, and mainly by injection, patient receiving from doctor and actually from the immunologist, with the correlated to infectious killing infectious clinic, and plus the oncologist if it's necessary. So hopefully this session helped you. Today I'm saying this was just advice. This is not the whole of our immunity. If I get time, I will talk more. Just briefly. Thank you very much. Take care. Bye. 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 Bye.